Hearing will be broadcast live on the House Budget Committee website. Each participant has a control bar at the bottom of their screen that includes a mute button and a video on/off button. The view control buttons in the upper right of your screen control your personal view and can be switched between active speaker and gallery view. This is your individual view and will not affect anyone else or what the public sees during the proceeding. We ask that you please leave your screen in gallery view throughout the hearing so you can see the timer, witnesses, and your fellow members. Please note that the timer is its own square and will only be visible if you are in gallery view. It will remain there throughout the event, and all participants are automatically muted upon entry to the hearing. In a moment, I will mute any participants who have taken themselves off mute. All participants are asked to keep themselves muted when not actively engaging in the discussion, which should help limit echoes or other disruptions. In instances in which members yield back or otherwise conclude their turn speaking but do not remember to remute themselves, I will do so to limit inadvertent background audio. Members and witnesses are responsible for unmuting themselves anytime they wish to be heard. With that, Chairman Yarmouth, we are ready to begin.
All right, 5, 4, 3, 2, 1. This hearing will come to order. Good afternoon and welcome to the Budget Committee's hearing on the Department of Health and Human Services FY 2023 budget. At the outset, I ask unanimous consent that the chair be authorized to declare a recess at any time without objection so ordered. I'll start by going over a few housekeeping matters. We will likely have votes during this hearing and will have to recess briefly. Because our witness has a hard stop time this afternoon, I strongly encourage members to return promptly after votes to ensure they have time to question the witness. Now, the committee is holding a hybrid hearing. Members may participate remotely or in person. For individuals participating remotely, the chair or staff designated by the chair may mute a participant's microphone when the participant is not under recognition for the purpose of eliminating inadvertent background noise. If you are participating remotely and are experiencing connectivity issues, please contact staff immediately so those issues can be resolved. Members participating in the hearing room or on the remote platform are responsible for unmuting themselves when they seek recognition. We are not permitted to unmute members unless they explicitly request assistance. If you are participating remotely and I notice that you have not unmuted yourself, I will ask you if you would like staff to unmute you. If you indicate approval by nodding, staff will unmute your microphone. They will not unmute your microphone under any other circumstances. I would like to remind members participating remotely in this proceeding to keep your camera on at all times, even if you are not under recognition by the chair. Members may not participate in more than one committee proceeding simultaneously. If you are on the remote platform and choose to participate in a different proceeding, please turn your camera off. Finally, we have established an email box for submitting documents before and during committee proceedings, and we have distributed that email address to your staff. Now I will introduce our witness. This afternoon, we will be hearing from the Honorable Javier Becerra, Secretary of the Department of Health and Human Services. I now yield myself 5 minutes for an opening statement. Secretary Becerra, I'm not sure if it still feels strange to be on this side of the dais, but it's always great to welcome a friend to our committee. Thank you again for testifying today on the President's proposed 2023 budget for the Department of Health and Human Services. I also want to commend your leadership during what has been an incredibly difficult time for our nation as we continue to battle the COVID pandemic and its impact on American families. When considering this budget proposal, it is important to look back to the beginning of this crisis. To put it bluntly, our public health system was woefully unprepared for COVID-19. Years of irresponsible austerity under the budget caps took a toll on our public health infrastructure and readiness. Former President Trump had gutted key public health agencies and, in an astonishingly short-sighted move, disbanded a White House council charged with pandemic preparedness. Vaccine development was underway, but there was no distribution plan in place. Fast forward 1 year. The American Rescue Plan has now helped us make considerable headway in the fight against COVID-19. It put in place a massive vaccination campaign, invested in state and local public health systems, and lowered healthcare costs for millions of Americans. Thanks to the American Rescue Plan, more than 216 million Americans have now been fully vaccinated against COVID-19, and American families saved an average of $2,400 on their annual health insurance premiums this past year. But we can't wait for the next pandemic or rely on emergency action to ensure our public health systems are up to the task. That is why the Biden budget request for HHS meets the needs of today while strengthening our public health system for decades to come. This starts with an overall discretionary budget funding level of $127 billion for HHS, more than $13 billion over 2022 funding levels, along with major investments in our public health systems and surge capacity so we are prepared for future pandemics and biological threats. The Biden budget increases discretionary CDC funding by 28% and expands no-cost access to vaccines, including a new program to provide all recommended vaccines to uninsured adults for free. This budget proposes the smart, forward-looking investments we need. It invests heavily in research and development, including $5 billion for the newly established ARPA-H initiative to accelerate development of treatments and cures for devastating diseases, including cancer, diabetes, and Alzheimer's. The budget puts us on track to meet President Biden's goal of cutting cancer deaths by 50% over the next 25 years, which would save 300,000 lives and hundreds of billions of dollars annually, and lays out a strategy to reduce HIV infection by 75% over the next 3 years. 2 years of this pandemic have had far-reaching consequences for our society. This budget recognizes that, and it puts forth real resources to address challenges that COVID exposed and exacerbated. It dramatically expands mental health benefits and coverage. It lowers costs for mental health services by requiring private plans to cover mental health benefits and takes steps to address the persistent shortage of behavioral health providers. And it makes historic investments in youth mental health services and suicide prevention. This budget targets systemic health disparities and invests in vulnerable communities that have historically been left behind or ignored. This includes investments to lower America's unacceptably high maternal mortality rate, especially among Black and Native women, and substantial increases in funding for low-income women's health care through the Title X Family Planning Program. And recognizing our obligations to tribal communities, this budget provides $142 billion for Indian health services over the next decade, guaranteeing a stable funding source for IHS going forward. Finally, the Biden budget invests in our nation's children with sizable increases for the Child Care and Development Block Grant Program and Head Start. We've learned a lot from this devastating pandemic, and chief among those lessons is that our public health systems must be adequately funded and fully equipped to combat public health threats before they emerge. We cannot afford the human and economic costs of being unprepared again. This budget ensures that the next time we are hit with a health threat, and we will be, our public health infrastructure is ready to respond. It's also about making major discoveries, which will change the outlook for millions of Americans facing debilitating and life-threatening illnesses. The budget's massive investments in research and development will undoubtedly lead to new treatments and cures. It will save lives. Secretary Becerra, your department has put forth a responsible, compassionate, and forward-looking budget. Thank you again for your leadership and appearing before us today. I look forward to your testimony. And with that, I would like to yield to the ranking member, Mr. Smith, 5 minutes for his opening statement.
Thank you, Mr. Chairman. Welcome, Secretary, back to the Budget Committee. It's good to have you. It's good to have you in person. As the head of HHS, you oversee one of the largest budgets in the entire federal government, annually well over $1 trillion. For 2023, President Biden's budget has proposed giving you a 12% raise to $1.7 trillion over the past 2 years. Congress has also given your department trillions more to fight COVID. Such levels of funding demand a thorough examination of how, when, and where you have chosen to deploy those resources. When the Biden administration came into power, it inherited 2 authorized and incredibly effective vaccines, therapeutics, testing, and a national distribution network. Yet somehow the government seemed to have its worst response yet to the pandemic in 2021. In his first month in office, President Biden shut down Operation Warp Speed, the Trump administration program that had set you all up for success. In March 2021, Democrats passed their $2 trillion American Rescue Plan, claiming it was urgently needed for COVID relief. But less than 9% of those funds went directly to fighting the virus. Dozens of examples of billions of dollars worth of waste as a result of this law have been documented. Taxpayer dollars going to build parking lots, golf courses, luxury apartments, and sports stadiums, among others. Your department diverted $1 billion from a NIH study for long COVID to house illegal immigrants at the border. You then backfilled NIH's funding with money meant for COVID vaccines and testing. Last summer, you rerouted even more money, $2 billion to be exact, this time from the American Rescue Plan to house illegal immigrants. In short, our own government is using taxpayer dollars to prioritize illegal immigrants over its citizens. Over Christmas, we saw a massive testing shortage. Thousands of people stuck freezing in long lines, waiting for tests. It was later revealed during a Senate hearing by officials in your own department that the Biden administration failed to place new testing orders for the first 9 months of 2021. Such failures were not the result of a lack of funding. The American people have given generously and have sacrificed a great deal. These failures point to a lack of leadership and decision-making at the highest levels of the Biden administration. Remarkably, the Biden administration got $2 trillion and ended up less prepared to battle COVID. The funding request in the president's budget comes out to an 11% raise for HHS. That's not including the tens of billions in extra emergency COVID money the White House is currently asking for, but fails to account for it. That same budget cuts border security too. Clearly, the administration has learned nothing over the past year. The sad truth is that the president's budget fails to address the crises his administration has created. In fact, it only makes them worse. Since President Biden took office, there have been more than 2.9 million border encounters, a 426% increase over the previous year. Over 12,000 pounds of fentanyl, enough to kill every man, woman, enhance the health and well-being of all Americans. And yet this budget that you're advocating eliminates protections for the unborn. It rejects the longstanding bipartisan prohibition against federal tax dollars going towards abortions. With credible concerns about COVID-19 originating from the labs in Wuhan, China, the budget does not prohibit funding for viral research in China, nor does it increase oversight on taxpayer-funded research. Reports indicate you allowed teachers' unions to edit CDC guidance that ultimately harmed millions of children by keeping schools closed. There is nothing in this budget that acknowledges or seeks to rectify those mistakes. Everywhere you look in this budget, enshrined are the failed policies that brought us to where we are today. I hope, Secretary, you're ready for some questions because the American people have a lot of questions and they want answers. Thank you, and I yield back, Mr. Chairman.
Thank the ranking member for his opening remarks. In the interest of time, I ask that any other members who wish to make a statement submit their written statements for the record to the email inbox we established for receiving documents before and during committee proceedings. We've distributed that email address to your staff. I will hold the record open until the end of the day to accommodate those members who may not yet have prepared written statements. Once again, I would like to thank Secretary Becerra for being here this afternoon. The committee has received your written statement, and it will be made part of the formal hearing record. You will have 5 minutes to give your oral remarks, and you may begin when you're ready.
Chairman Yarmouth, Ranking Member Smith, and members, thank you for having me. Thanks for letting me come back to the Budget Committee. Today, more than 255 million Americans have received at least one dose of a COVID-19 vaccine. 2/3 of adults over age 65 have gotten their booster shots. And we've also closed the gap in vaccine rates we usually see for communities often left behind. It has paid dividends to surge resources, including tests and treatments, to our hardest hit and highest risk communities. 325 million free COVID-19 at-home tests shipped out. 270 million free N95 masks made available. From the $186 billion appropriated by Congress for the Provider Relief Fund, 766,000 payments to over 400,000 providers who have received payments for COVID-19 services. That's over 400,000 doctors, hospitals, community health centers, pharmacies, labs, nursing homes, and long-term care facilities, all receiving this critical support. This is real money, real relief, real results. On Monday, I had a chance to meet with Medicare beneficiaries who are now able to purchase their over-the-counter COVID-19 tests with their red, white, and blue Medicare card. Mr. Chairman, this marks the first time that Medicare has covered an over-the-counter test at no cost to beneficiaries. That's a game changer. Beyond COVID-19, today more Americans have insurance for their health care than ever before. That includes a record-breaking 14.5 million Americans who now have secured their health insurance through the Affordable Care Act. That's a big deal. Also this week, the Biden administration is issuing a rule that will fix the health insurance family glitch, which leaves out family members from affordable coverage. Less noticed, but just as important, we launched Operation Allies Welcome, an HHS-led effort that has helped over 68,000 Afghan brothers and sisters resettle as refugees in America. And we're coordinating nearly $300 million in support nationwide for the launch of the 988 National Suicide Prevention Lifeline later in July. HHS has also made key investments to close holes in our public health system in areas like maternal health, where we've extended Medicaid coverage for postpartum care for a new mother and her baby from 2 months to 12 months. The President's 2023 budget lets us build on that record of investment in America's health. It proposes $127 billion in discretionary budget authority and $1.7 trillion in mandatory funding, including a historic investment to transform the mental health infrastructure in our country, a priority I know many of you share. It also asks for $82 billion for the President's pandemic preparedness proposal to get ready for whatever might come next after COVID-19. Considering that COVID has cost this country more than $4.5 trillion in direct support from the federal government so far, this $82 billion investment is a no-brainer to prepare for the next pandemic. The funding we're requesting as well would be end-to-end, which means it would be for research, development, approvals, deployment, and effective response. Budgets represent not just dollars and investments, but our values and our priorities. This budget turns hardship into hope, inclusion into opportunity. And it's a commitment to finish the fight against COVID-19 and build a healthier America. On that note, I want to acknowledge our collective national failure to fund the Indian Health Services at the level needed to meet our constitutional treaty and our trust obligations to tribal nations in America. But even more importantly, the elemental level needed to provide fair and sufficient resources for Indian country. I've seen these shortfalls firsthand in my visits to Indian country. We must be serious about meeting our constitutional and legal obligations to address the health needs of more than 2.7 million patients served by IHS. The President's FY 2023 budget takes a historic first step toward finally delivering on our long overdue commitments to tribal nations. In my written testimony, I detail our proposal to convert the IHS budget to mandatory funding and to bolster it significantly over the next 10 years. This budget is strong and it's a great start, but we must continue to shine a light and hold ourselves accountable on our promises. Mr. Chairman and members of this committee, I look forward to working with you to make the President's 2023 budget a reality and to continue our efforts to give Americans real relief, real results, and real peace of mind. With that, I'm prepared to answer any questions.
Thank you very much, Mr. Secretary. And we'll now begin our question and answer session. As a reminder, members can submit written questions to be answered later in writing. Those questions and responses will be made part of the formal hearing record. Any members who wish to submit questions for the record may do so by sending them electronically to the email inbox we have established within 7 days of the hearing. Let me also say that because of the constraints we have today, a vote series that will interrupt the hearing for probably at least 45 to 50 minutes, I'm going to be very strict with the gavel, and any member who runs their time down to the last 10 seconds and asks a question, I am going to gavel them down and then ask for the response to be made in writing afterwards. That's fair to, I think, fair to the witness, and again, will help us expedite the hearing. So with that, I now yield 5 minutes to the gentleman from Texas, Mr. Doggett.
Thank you very much, and thank you, Mr. Secretary, for your important service. As you know, one of my principal concerns has been price gouging by pharmaceutical companies. I know that you have been here recently to ask the Congress to provide supplemental COVID funding, which is no doubt needed. But I just want to indicate before I vote for it, I want a better idea of what taxpayers have already paid for COVID funding to date, billions of dollars to pharmaceutical manufacturers. And I think it's very important that your administration do more than has been done to date to be transparent about that. The only contracts of those pharmaceutical contracts that have been released to the public have been heavily redacted. It's not sufficient to just stamp them top secret or trade secret to deny access to the public about the pricing and terms of those contracts. And I just hope you will review that with your staff and find a way to make more available to the public generally about what is in these contracts. And going forward, I think it's really important on the contracts that you enter that there be reasonable pricing clauses wherever the taxpayer has funded the research, as happened 100% on Moderna vaccine, so that there is a preserved interest of the taxpayer in the investment that's been made. You know, I don't believe there's been a president in the history of the United States who said more about the damage being done by the pharmaceutical industry than President Trump. Unfortunately, he did next to nothing about it. And it's pretty clear that this Congress still remains under a stranglehold from Big Pharma. If anything is to occur meaningfully to protect American consumers and taxpayers for pharmaceutical price gouging, it will have to come from this administration. There are many things that the administration could do on its own initiative. One small one is to proceed to grant the hearing that is pending now on the price of Xtandi, a prostate cancer drug that was developed with U.S. Army and NIH grants to determine whether it's fairly priced to consumers and what standards should apply. I would just ask you to review that in ways that the administration can be helpful in responding so that at the end of this year, this administration's record is better than the Trump administration's record, and it won't have to do much in order to achieve that objective. A second area you know that I'm very concerned about is the coverage gap. A significant number of people, 2 million in Texas, according to CMS standards, and over 6 million across the country have been left out and left behind because of the failure of states to do their part with Medicaid expansion. I hope you will continue to make that a top priority to close that coverage gap. The provisions that are proposed in Build Back Better concerning adding these people into marketplace plans is a good way to address it. If that can't be achieved, as you know, I have a Cover Now Act that is designed to let cities, hospital districts contract directly, perhaps demonstration projects. We could cover in just 3 cities in Texas half of the people that have been left out and left behind. So I just encourage you to work in all those areas. And finally, one of the areas that I know you are working in already concerns President Biden's pledge to address the suffering that's occurring in our nursing homes across the country. The pandemic has exposed so many deficiencies, poor infection control, little corporate accountability, inadequate staffing, poor working conditions. President Obama had an excellent set of standards that he was proposing that have been dropped over the last 4 years. This is the type of action that family advocates across the country, like Sissy Standards in Austin, have been seeking. Perhaps you could just describe in the minute you have the general direction that you're taking on nursing homes and when you think we might see some reforms.
Congressman, thank you for the question. Good to see you. On nursing homes, we are going to try to work as aggressively and as swiftly as we can to undertake the president's proposals. One of those would be to strengthen the workforce. A second one would be to do much more oversight. We intend to try to make sure that the staffing levels at these nursing homes are adequate so that they meet the needs of the residents who are there. We want to make sure that the monies that we're providing, whether through the Medicare program, Medicaid program, if there are any government dollars that are being provided, that we're getting our money's worth. And the most important thing we can tell you is that with your support, and if you continue to provide us with the resources that we need, we'll be able to do some vigorous oversight. But first and foremost, we have to make sure that those nursing homes are keeping people safe from COVID. We have to make sure that they are providing, they're fully equipped and they're adequately staffed to make sure that they are providing the services that they're charged.
For emphasis, echoes for emphasis. Gentleman's time has expired. Now recognize the ranking member, Mr. Smith, for 10 minutes.
Thank you, Mr. Chairman. Secretary, Operation Warp Speed under President Trump set the country up for success in its battle against COVID-19 going into 2021. With 2 effective and authorized vaccines, therapeutics, testing, and a national distribution network. Given that, why was the Biden administration's response to COVID in its first year full of so many stumbles, given the tools provided and systems already in place when you all walked in the door?
Congressman, thank you for the question. And I want to take you back to where we were when President Biden took office. Less than 1% of Americans had received a vaccine. And we had a situation where the efforts were not nationally coordinated. And we had to stand up an infrastructure to make sure that we get not just vaccines, but therapeutics out. There was not one single therapeutic that, a medicine that any American could take that would be available orally for that individual. There were, at the time, very few provisions for treatment, the tests that people would need to take. There were no tests available to Americans that they could take at home. And things have changed. As I said in my opening testimony, today, more than 255 million Americans have received a shot in the arm. More than 560 million vaccines have been administered overall, when you count boosts and the rest. And we have now made available hundreds of millions of tests. We have ordered and paid for hundreds, and in most cases, thousands of the therapeutic medicines that some people need who have contracted COVID. Night and day. Today, we are opening up. We've gone through 2 major variants in that 1 year, and both more potent than the original natural virus. And so what we see is that progress has been made, but we're not yet out of the woods.
Thank you, Secretary. One of the big concerns to me is this past year, it appears that it was marked with a lot of chaos on the response front. There were more COVID deaths in 2021 than in 2020. In fact, by 102,882 more to be exact. And this administration started out with the vaccine, least it was created. That's 128% more in COVID deaths in 2021 than 20. Again, the vaccines were approved whenever you all walked through that door, and conflicting guidance coming from your CDC, masking, no masking, when to open, when not to open, contributed not just to confusion, but undoubtedly to more Americans getting sick or suffering other consequences. You gave yourself $2 trillion in additional so-called COVID relief funding on top of the $4 trillion Congress had already enacted. In retrospect, might it have been a bad decision to dedicate less than 9% of the $2 trillion from the American Rescue Plan to combating COVID-19, particularly given the fact you are now asking for more money to Congress?
Congressman, first, I'd be interested in seeing your math because I don't think it's accurate in terms of how we've deployed the resources that were given to us. We know here at HHS that what we have done with the money that you've made available. First, we say thank you for those who voted for those resources because they've been indispensable, but we have used them to be able to make available those hundreds of millions of vaccines to all Americans. No American is denied a vaccine today. No American has had to pay a penny for those vaccines. We now have the therapeutic medicines that help you stay alive if you do contract COVID.
So, Mr. Secretary, I just want to know, you felt like that there was enough money in the $2 trillion bill, that how much was allocated to HHS in the $2 trillion bill that passed Congress a year ago was sufficient?
Congressman, I will take every penny you all give us, and we will make.
Was it sufficient that was passed of the $2 trillion?
We used every bit of it, and we're beginning to now run out of that gas to keep it going, and we will need more.
Thank you, Secretary. I will just say we found numerous examples, and my team would be more than happy to show that less than 9% of the $2 trillion actually went towards killing the virus. But the numerous examples that we did find was billions of taxpayer dollars being wasted, planting thousands of trees, building a high-end hotel, a spa, and golf courses, renovating a baseball stadium, new weight rooms, luxury apartments, the list goes on that was in that $2 trillion COVID package. How does spending $2 million of taxpayer dollars on planting trees in Syracuse, New York, help fight COVID?
Congressman, what I can tell you is what we've done with the money that we received and what we did.
Does planting trees in Syracuse, New York help fight COVID?
As I said, I can speak to you what we did with our money, and we
I'll-
made very good use of the money, keeping Americans alive and healthy.
I'll take that as a no. And I also think that sending $1,400 checks to Japanese citizens living in Japan did not help stop COVID. I wonder what that's all about. But there seems to be a lot of decision makers in this administration. We have Gene Sperling as the American Rescue Plan czar. We have Jeff Zients as the COVID response coordinator. It makes me wonder who is ultimately responsible for making decisions on whether it is appropriate for state and local officials to spend $4 million building a new beach parking lot in South Carolina, or $250 million of COVID relief on state parks in Michigan. Where does the buck stop? With you, Mr. Sperling, Mr. Zients, President Biden? Who's making those decisions?
Congressman, if you have any questions about the way HHS has deployed its resources, I'm more than willing to answer those questions. We feel very confident that what we can show is that the American people are receiving real results as a result of the work that was done by HHS employees nationwide.
I appreciate that. Maybe from the prior $2 trillion COVID bill, we shouldn't have used $783 million in stimulus checks to convicted prisoners, including the Boston Marathon bomber. Since I do want to talk about resources that were delegated to the HHS in that spending bill, let's jump to that. Can you tell us how much funding your department has spent over the past year, plus to fly illegal immigrants from the border to various communities across the country?
If you're asking for the last 365 days, that might be more difficult, but I can give you an idea generally of what we have done with some of the money that we've received.
Did you use any of the money in the HHS budget to fly illegals from the southern border to other communities in the country? Yes or no?
We have an obligation, Congressman, to make sure that those migrant children who are unaccompanied by an adult have a safe place to stay while they're temporarily going through their immigration process. We house some of those. Well, we house some of those immigrant children until we're able to find a sponsor, if we're able to find a sponsor, who will house that immigrant while the child is waiting for its
So can you
hearings.
tell me within this budget, show me in this budget where you are planning to use taxpayer dollars to fly illegal immigrants from the border to various communities throughout this country, and how many taxpayer dollars do you estimate you'll spend in the months to come in such flights? Where's it at in the budget?
You can find the information under the the Office of Refugee Resettlement that deals with the unaccompanied migrant children. And what we are obligated to do by law is take possession and custody of a child once they've been placed in the hands of Department of Homeland Security. They are only allowed to keep those children for a short amount of time. We must then take them and we place them in a facility that is able to care for children. Not all of those facilities are there on the border, in American communities along the border. So we do make sure we place them, if we can, in a licensed care facility that is able to care for children.
Also, there's been a lot of conversation about money being transferred, $2 billion, in fact, that was taken from the strategic stockpile and for COVID testing that was used with illegals at the southern border. Where was the authority to do that?
So I'm not sure where you brought the strategic stockpile in, but what I can tell you is that the COVID monies that we have used, including some of the monies to address the needs of those migrant children, because of COVID, they were not immune from getting COVID, and we would have to do the systems and the processes necessary to make sure that they were tested, make sure that they were not COVID positive, so they would not infect others around them, including the children. And so we did use some of the COVID money made available through Congress to address the COVID-related concerns and services necessary for migrant children.
I see my time's running out in 7 seconds. Secretary, thank you for being here.
Thank you.
Mr. Chairman?
Yes, gentleman from Texas.
The ranking member raises a number of examples that concern me, and I think it would be helpful if you could put the information you were going to give Secretary Becerra into the record so that we can evaluate those, determine if those were decisions made in the huge bill that we approved or by state and local governments using that money or where it was spent. I don't think any but the last you discussed had anything to do with the Secretary of Health and Human Services, but it's something that our committee in our oversight role certainly need to look to see if this money was misspent in any way. So I just ask that you do that.
Gentleman willing to do that?
I am more than happy to submit to the record. Also, I would love for this committee to have an oversight hearing so we could look into how the money was spent. We've sent a request to the chairman, and it would be awesome if we could just not submit it to the record, but actually have a hearing and a discussion of oversight of $2 trillion.
Thank you.
I thank both of you. I now recognize the gentlewoman from Illinois, Ms. Schakowsky, for 5 minutes.
Thank you, Mr. Chairman, and thank you, Mr. Secretary. Always great to see you. I wanted to talk about seniors, no surprise, because I am the chair of the Task Force on Aging and Families, and this has been a priority for me, as you know. So there's nearly 1.3 million seniors and people with disabilities who are living in nursing homes right now, and each one of them deserves a really good quality of life. The pandemic was just terrible, you know. Number one of people who died, people in nursing homes, that, you know, was kind of a death trap situation in many ways. And, you know, public dollars through Medicare and Medicaid make up 70% of long-term care funding. So taxpayers are really paying for these institutions, and yet what we see is private equity firms have gotten more involved. I mean, nursing homes too often, I think, are seen as a way to really make some money, sometimes milking them for the money, and we need to do better. So, Secretary Becerra, we are really grateful to President Biden for the initiative to improve nursing home quality, safety, and oversight, and we really welcome what was said is almost $500 million included for the Centers for Medicaid and Medicare and Medicaid Services, CMS, for that purpose. So what I really want to know, and what keeps me concerned, is whether this is actually going to be enough to address what I think is a really big issue of making sure that we're able to improve care in long-term care facilities.
Congresswoman, first, great to see you again, and thank you for the hug earlier in the hallway.
I wasn't going to mention that, but it was a good hug.
The president made it very clear that we're going to really go in and look deep at nursing homes, because we saw so many Americans die as a result of COVID. That was where we saw the greatest number of Americans dying.
Over 200,000.
Yeah, and unfortunately dying by themselves because then they couldn't be joined by their family members. And so we just can't experience that again. So the president has laid out some pretty strong markers. We're going to do more oversight. I mentioned this to Congressman Doggett. We're going to make sure that we find out if these facilities are adequately staffed, if they have people who are adequately trained. The president in his budget does provide resources that makes it possible for us to provide additional relief to about 1.5 million caregivers and families, so we can increase the access because the demand is so great. But we're also going to do something a little differently as well. There are a lot of those folks who are in nursing homes who don't have any choice because families don't have an alternative, home and community-based services
Yes.
are a great alternative, because if your loved one can be at home where he or she feels the most comfortable, surrounded by loved ones, cared for by loved ones, with some professional help, that's the best way you can go. I say that as a son who had a chance to watch his father pass away in my home, and cared for him and my mother for 4 years while I was living in Sacramento. There is nothing like it, and we're gonna, especially if you pass Build Back Better or some elements of it, we'll be able to make game-changing investments in home and community-based care. And I hope that what you do is realize that Americans are crying out for the ability to care for their loved ones closest to home as possible.
No question about it. And, we also want to think about the workforce and the workers themselves. That's right. And, if you're a home care worker, the average wage that you make is something like $12 an hour around the country. So it's really hard to get people to do that work, even though they want to do that work. So we have to care for the caregivers, both the home caregivers, the family caregivers, and the people who work there too. But so thank you very much. We're gonna, anything we can do to work with you, with our task force, to make sure that home and community-based as well as the facilities can benefit. So thank you.
Thank you.
The gentlewoman's time has expired. I now recognize the gentleman from Wisconsin, Mr. Grothman, for 5 minutes.
Thank you. I'm going to lead off talking about one of my pet topics. I spoke last week with a Dr. Dror from Israel, and he felt, it was a small study, I don't think the sample's enough that you could write home about it, but he found that people who were vitamin D deficient were 14 times more likely to get severe COVID and 11 times more likely to die. I also talked to a Dr. Meltzer from the University of Chicago. I'm not going to quote his numbers, but I think it would be accurate to say that he feels that over half of the COVID deaths could have been prevented with adequate vitamin D. And a guy by the name of, his name is Carl Flieger from Stanford, who may be similar amounts. And I've tried to, in my own little world, publicize it. But when you're talking about a life savings of that amount, it's very frustrating to me that you, and I'll include your predecessor in the group, have done nothing to publicize that. I mean, you can't turn around without running into things about social distancing or masking or vaccinations, enough that everybody has heard these things millions of times over. But the fact that and of course, if you publicized vitamin D more, not everybody would take it, just like not everyone gets a vaccine. But I think you can get a lot of people to take it, and it's apparently good for other health problems other than just the COVID. I mean, you talk about 11 times less likely to die, it's kind of a big number. I wonder, in my district, people are beginning to feel that the reason that the establishment doesn't push it is because you can get a big bottle of vitamin D for $20 at Walgreens, and they'd rather, that there's no money to be made in it, so we don't push it. But could you give me your opinion of vitamin D and say in the future, with all the money you have floating around, may you want to tell about these, publicize it a little bit more for people?
Congressman, thank you for the question. No doubt that vitamin deficiencies lead to a lot of different consequences in the health of so many American people.
11 times more likely to die.
And so what I would say to you is that the health professionals and the scientists at Health and Human Services, whether it's at CDC or FDA, NIH, I know that they are doing some extremely important, some of the most cutting-edge research, and I'm not prepared to give you exactly what they're doing right now on the issue of vitamin D, but I'm certainly willing to follow up with you. But I agree with you to the point that vitamin deficiencies can lead to lots of consequences for folks, and so we know that there are real efforts should be underway to make sure that we're doing the things that are most basic and cost-effective to try to keep people healthy.
Well, I mean, there are so many studies out there. Now, I think the problem they have is all these studies show correlation, not necessarily causation. But when you have things like 11 times more likely, And I can give you these names of these professors from around the country. I mean, the idea that we're 2 years into this pandemic, and I guess even Dr. Fauci, who I have a low opinion of, I guess even he has privately told people how much vitamin D he takes. But for some reason, when he gets on TV, he zips his mouth. And I do feel, and like I said, your predecessor's in the same boat, because I certainly tried to publicize it before Biden was elected. Couldn't get a lot of movement then either. But I want you to look at it and maybe publicize it, and maybe you can cure, we could have saved a lot of lives. I mean, I think 300, 400,000 in my opinion. But I talked to you in the Labor Committee with regard to what I felt was too much emphasis on racial groups, that sort of thing by your agency. I'll mention here, maybe you recognize it, new payment model for physicians who implement anti-racism in their care plan. And an implication in some of the monoclonal antibodies distribution that race should come into play. I have the documentation here. Do you feel your office is emphasizing, I mean, to me, a person's a person. I will say, with regard to vitamin D, they could emphasize that dark-skinned people are more likely to be vitamin D deficient. I think I'm the only one who talks about that as well. You could have really saved a lot of lives there. But, yeah, do you feel you're pushing this divisiveness by race a little bit too much in your agency?
I'm going to have to say the gentleman's time has expired.
And Congress, Mr. Chairman, I can answer it's expired,
Okay.
but I would say no, the answer is straightforward, no. We're looking towards equity to make sure no one's excluded.
I thank the Secretary for that quick response. I now recognize the gentleman from Michigan, Mr. Kildee, for 5 minutes.
Thank you, Mr. Chairman. Mr. Secretary, it's always good to see you. Thank you. Good to have you back.
Thank you.
And thanks for being here. I was really pleased to see in the proposed budget regarding the Indian Health Service a change that we've been long advocating for. The federal government, as we know, has a trust responsibility to ensure uninterrupted health access for tribal communities. It's something that you and I worked together on when you were here in Congress. Currently, the Indian Health Service is funded differently than other health programs, as you know, like the VA, for example. This unequal treatment means that access to health care is often at risk in the event of a government shutdown. And of course, this is not a hypothetical situation. When the government partially shut down from 2018 to 2019, the staff employed at the Indian Health Service clinics had to work without pay, and important preventive tribal health programs were forced to stop. And that's just not right. As a member of this committee, I've been advocating for some time for parity between IHS and other federal health programs. And I thank the chairman, I obviously thank President Biden and yourself for including this initiative in the annual budget. And I'm committed to working with the administration to get this fixed. And I wonder if you can perhaps address how important permanent funding that is not subject to the whims of congressional action and being suspended by a shutdown could have an impact on tribes that deliver services, tribes like the Saginaw Chippewa tribe that I represent, and particularly if you just might address how this initiative and others might help address care for tribal communities.
Congressman, first, thank you for your leadership on this issue for so long. I think you mentioned it. I think we feel we have a moral obligation to help our veterans. We have a moral obligation to help seniors who have contributed to the Medicare program. We have a moral obligation to our children to make sure that they can grow up healthy, and we provide the CHIP program for them, Medicaid. We not only have a moral obligation to our tribal communities, we have a constitutional obligation. It is in the Constitution. And in the treaties that we've signed, we have a trust obligation to do these things, yet we've never done it. And it's high time we do. And it's been, as I said, a moral failure on the part of the nation to not recognize it. Perhaps because the Native American population is so small, some people can ignore it, but we shouldn't, because we're talking about the health of human beings, our brothers and sisters. And so I am I am proud that President Biden is the first president to step forward and say, it's time to recognize not just our moral obligation, but our constitutional and legal obligation to Indian country to do what we should have been doing a long time ago for these tribal nations.
Well, I thank you for that, and I know you worked with and served with my late uncle Dale Kildee, who actually once served as a member of this committee as well, and this was part of his life's work. And so the fact that we're in now a position to see this action taken, I think is in many ways a testament to his long work in this subject. So I thank you for that.
Amen.
Another subject that I've been working on and spending a great deal of time on has to do with the access to affordable clean water. We all know what took place in my hometown of Flint, Michigan. If it were only just an anomaly and not a warning to the rest of the country, it would be sad enough, but it really is just a warning. The problem that we have, though, is in many of the communities like my hometown, water is really expensive. An average family in Flint pays $864 a year for water. Some people pay into the thousands of dollars a year for drinking water. So I was happy that we were able to work together to form the Low-Income Housing Household Water Assistance Program, secured $1 billion for that effort. The program is making a difference, but it's set to expire at the end of 2023, and water is not going to suddenly become affordable at the end of 2023 in many of those communities. And I wonder if you might just discuss your thoughts on the Low-Income Housing Water Assistance Program, what it means for places like Flint, Saginaw, Bay City, and others, and what the administration hopes to do in extending funding for this really important water assistance program.
Congressman, the president's budget proposes to build on that program because it's so essential. I can point to communities in California where they can't open the tap anymore because water will either not flow or it's too dangerous to drink. And so it's the same whether it's at Flint or in some town in California or throughout the country. No one in America in the 21st century should not be able to open the tap and be able to drink the water. It's incredible in the richest nation in the world that we're talking about this. That's why the president has decided we're going to invest in this and work with you. So I hope that you continue to champion this because it's just the right thing to do. We should be able to take for granted that we're going to have safe drinking water for our kids.
Well, thank you so much, Mr. Secretary. I appreciate those answers. I appreciate your presence here and your great work. And I yield back, Mr. Chairman.
Gentleman's time has expired. I now yield the gentleman from Texas, Dr. Burgess, 5 minutes.
Thank you, Mr. Chairman. Mr. Secretary, thanks for being here today. Thanks for being in person. We love virtual hearings, but this is much better. So ARPA H, have you given any thought to where that is going to be located?
Yes, we made the decision under the omnibus
Smith, we
bill.
saw-
We were given some direction on this. ARPA H will be a very autonomous agency. It will have a director that reports directly to the secretary, in this case me. It will be able to use the assets under the auspices of the NIH. It will likely be housed, because it'll be a much smaller entity, it will likely be housed in a separate facility because we want it to be nimble, and it will work under different direction because it will not be constrained by some of the requirements that we see in law for government employees.
So a suggestion for you, I would locate it in the state of Texas if you want it to be nimble. Let me ask you a question. Title 42, we're all hearing about it. The administration says the public health part of Title 42 expires May 23rd. Numbers of people who are likely to enter the state of Texas is already high, and it's likely to be staggeringly high. Are you making any provisions in your budget for preparing people in communities that are going to be the recipients of very large numbers of people who are likely do not speak the language and may be low-skilled? Going to put strains on our education systems, going to put strains on our law enforcement, on our hospitals. How are we preparing the communities to withstand that? Since we're not going to protect the border, obviously.
Congressman, first, thank you for the question. There is an interagency process underway so we can all make sure that we are following through on our obligations. On HHS's end, we're trying to be supportive when it comes to some of the healthcare issues that might be encountered. We also have responsibility, as I mentioned earlier in some questions, for any of the migrants who might come across as minors.
So let me, I'm well aware of that. I've multiple visits to ORR facilities since 2014. Title 42 enacted March 20th of 2020. The death rate from coronavirus at that point was probably what, 10,000 if that? Is there a public health emergency posed by the rampant importation of fentanyl across our southern border? What is the number one cause of death from people 18 to 48 right now?
What I can tell you is that there is clearly a crisis going on when it comes to drug overdose and drug use. That's why we did change the strategy we have with regard to drug overdose. I will tell you as well that the Title 42 provisions that you mentioned deal with public health in a particular way. It deals mostly in terms of quarantine. It is different from the public health emergency declaration that is based on different law. But in both cases, they're premised on the health of the country and the health of particular communities. They're not based on immigration standards.
Yeah, but here's the problem. The danger to the American people is substantial, and the numbers are going to be staggering. Customs and Border Protection, DHS personnel on the border will be distracted by the large numbers of people that are just simply flooding across the border, leaving open the possibility for the vast importation of drugs, predominantly fentanyl, which is so terribly deadly, and we almost can't keep up with it. It is a true public health emergency. If there were a time to enact or to keep Title 42, it would be because of this fentanyl crisis. And I hope you will look into that. Let me ask you another question. Big bump in NIH funding. Of course, someone who spent his life in healthcare, it's a good thing. But I'm really worried about the development or the possible development of a virus in the Wuhan Institute of Virology. Even Jon Stewart has acknowledged that. Are we continuing to fund things like gain-of-function research in adversarial countries?
Congressman, I think this question has been answered before. The NIH does not fund gain-of-function research in adversarial countries.
But yet it happened. And we need to know why it happened, and it must never happen again.
Congressman, I don't know what you're saying the it is, but we neither funded gain-of-function research at Wuhan or in any adversarial country, and I don't believe the science and the facts are in yet to determine what the source of COVID has been.
Well, I will be happy to provide you the documents from the Dr. Danzig and the work that was done. It's been well documented in the lay press. It's not anything that's classified. I will provide that to you. There's a number of other questions I couldn't get to. I'll be submitting those in writing. Look forward to your responses.
Thank you.
Gentlemen's time has expired. They have called votes now about 6 minutes ago, so we're going to have 2 more 5-minute periods. That'll be Mr. Horsford and Ms. Boebert, and then we will recess through and there are 2 votes, so the series we ought to be able to come back within 25 or 30 minutes after we recess. Now I yield 5 minutes to the gentleman from Nevada, Mr. Horsford.
Thank you, Mr. Chairman. Good to see you, Secretary Becerra. I want to commend the Department of Health and Human Services and our entire healthcare profession. I don't care what administration, we need you to succeed so that we can crush this pandemic, save lives, get our economy back on track, kids back in school safely, and families together. So first, I'm not here to, come up with reasons to beat you up. I do believe there has to be accountability. And the first thing I want to speak to is the COVID-19 pandemic resources. As we learned from the past 2 years, the pandemic can only be addressed when we protect every single person. With an easily transmissible virus like COVID, none of us are truly safe unless everyone, especially those in our most vulnerable communities, has access to test, treatment, and an effective vaccine. Fortunately, HHS was able to do just that through the Health Resources Services Administration's HRSA uninsured program. Unfortunately, my Republican colleagues have demanded that any COVID-19 emergency supplemental be offset by other cuts. So now we are far too late in addressing the current shortfall in emergency funds that our country needs to continue to stem the damage from the pandemic. Now, I sent a letter a few weeks ago regarding HRSA's uninsured program. Sadly, that same week, HRSA announced that they would stop accepting new claims for testing and treatment in the middle of a pandemic. I don't know how that helps communities, small businesses, our economies recover when we're cutting off the very support that is needed. So, Secretary Becerra, would you be able to speak to just how crucial it is for Congress to pass an additional round of COVID relief funds to continue to protect Americans, our businesses, and along with the $82 billion requested in the budget for our public health infrastructure to continue to protect Americans from COVID-19 or any future pandemic?
Congressman, I don't know if I can say it better than you did, but, and I haven't had a chance since I've been hearing all day, but I haven't taken a look at the recent numbers for today for COVID. I get those every day, the reports and the briefings. But we are now at one of the lowest points we've been at for COVID infections, hospitalizations, and deaths. And we're also at a point of running out of the money it takes to keep that fight going to, as you said, crush COVID-19. This is the wrong time. I used an analogy in a committee hearing just earlier today, saying that we're inside the 1 yard line, within the 2-minute warning of the football game, and we need that touchdown to win. And this is not the time to cut off the resources we need to go over the goal line. We know what we need to do. We've been doing it effectively. The economy is opening up. We're all here today, most of us, without masks. This is not the time to have us run out of the funding. And so I urge Congress to provide us with the resources we need, not just to do the provider relief funding for those who provide services to the uninsured, but to continue the therapies, the vaccines, the tests, the masking we need.
And I just want to underscore this. You know, when the prior administration was in, when the prior president came to the Congress with a proposal, many Democrats, including myself, voted for that package. CARES, the family support resources that was passed. And yet now it's like under this administration in the same middle of the pandemic, we don't have one Republican on the other side who's willing to support the American Rescue Plan or the funding that's needed to crush this virus. I'd like to finish my time talking about Title X. For too long, Title X has been woefully underfunded. There's no reason why someone's income level or their zip code they were born in should prohibit them from being able to access affordable, high-quality, community-oriented family planning or sexual health services. So my question, Secretary, is could you explain some of the adverse consequences of patients foregoing important care because of a lack of adequate funding for Title X, especially in rural areas?
Congressman, I think we all know that there are too many families in America, and COVID pointed this out even more, that don't have access to the care they need. They fall through the holes, the gaps in the system, especially in our rural and inner city poor communities. Family planning services under Title X are a life-saving service that's made available to families which had been cut off for too many, and our president has made a commitment to restore some of that funding and allow those providers to be in the game again. What we're going to do is make sure that if you're seeking family planning services, you can get it from any organization that is qualified and professionally prepared to provide you those family planning services, so we can provide those needs to rural, urban, and suburban families throughout this country.
Gentleman's time has expired. I now recognize the gentlewoman from Colorado, Ms. Boebert, for 5 minutes, and after which we will recess.
Thank you, Mr. Chairman, and thank you, Secretary Becerra. Thank you for being here today. I appreciate you coming before the committee. To start off, as a Secretary of Health and Human Services, can you define for this committee what is a man?
You're looking at one.
Great. So you are a man. I like that. Can you tell me, can men get pregnant?
Unless you know something I don't, I think the answer is pretty obvious.
What is that answer, sir?
I'm asking you, is there something you know that I don't know that would say that a man?
Well, I'm
can-
asking what you know. Can men get pregnant?
I'm not aware of it.
Okay. Well, Mr. Secretary, materials coming from your department, you've referred to mothers as birthing persons, replacing that title with
Are mothers not persons?
mothers are persons, but it seems to be more inclusive, like you're trying to include another gender in that.
I'm all about inclusion, Congresswoman.
There you go. Well, just as a mother of 4 boys, I'm not necessarily offended at that. I am a person, but it's just unscientific and absurd
How so?
to include men in that. If you're going to be
person?
inclusive, if you're going to be inclusive in birthing persons, yes.
Well, but it seems to me that you're
Let's
trying to
back up.
define the term.
Reclaiming my time. Can men get pregnant? So then we don't need to include them in this. Mothers are mothers. Moving forward, Mr. Secretary, I want to read for you from a document from your office, the Office of Population Affairs. It says in here, and I quote, "Gender-affirming care encompasses many facets of healthcare needs and support. It has been shown to increase positive outcomes for transgender and non-binary children." Mr. Secretary, what is a transgender child?
A child in America is a child in America, and I hope you and I can love that child just as much as we
Can you
love our own
define what a
children.
transgender child is?
That's a child in America, and it's an American citizen child who needs the services and love just the way any other child does.
Mr. Secretary, do you believe that a child is capable of making life-altering decisions to maim themselves?
So let me just say to you that I don't agree with your premise, but what I will say to you is children know much about themselves, and with the help of
Do you
their,
believe that children are capable of making the decision to self-mutilate?
again, I don't necessarily accept the
Well,
premise of your
Mr. Secretary, I
question.
mean, you have gender-affirming care for young people, so this is something that
I
you
don't
have looked
equate gender
over.
affirming care to mutilation. So if that's where you're going, then you're not going to get the answer you want.
So, Mr. Secretary here, can you tell me if there have been mastectomies, mastectomies, penectomies, or hysterectomies on children?
Wow.
And have taxpayers funded that?
So I could probably use the help of my wife, who's an OBGYN, who could talk more, or maybe Dr. Burgess could help us out here.
For gender-affirming care, to be included in that?
I'm sorry, pose the question one more time, please.
In this gender-affirming care, Mr. Secretary, have there been tax dollars put forward to fund mastectomies, penectomies, and hysterectomies for sex reassignment purposes for minors with gender dysphoria?
So Americans are entitled to receive healthcare services. If they are entitled to receive any of the services that you just mentioned, then it would be against the law for us to try to deny them that care.
So for the record, you favor HHS's funding being able for sex reassignment, for surgeries on minors?
I will do everything I can to defend any American, including children, whether or not they fit the categories you have mentioned or not, and if they talk about gender-affirming care, I am there to protect the rights of any American.
Mr. Secretary, I want to turn to a different document. Your office released this gender-affirming care is trauma-informed care. In this document, you clearly state that gender-affirming care includes puberty blockers, hormones, and surgeries for minor children. You go on to assure parents that there is no scientifically sound reason to doubt hormones and surgeries are helpful to minor children. You also discuss this in a document that the potential for removing children from their parents is on the table if they're not providing gender-affirming care. Mr. Secretary, do you think that parents who believe in 2 genders only should have their children removed from them?
Mr. Secretary, you can answer or respond in writing. Your time has expired.
I can respond very quickly. Congresswoman, I believe in supporting and protecting transgender youth. I believe that they, along with their parents and their caregivers, will make the best decisions. And I would really urge that politicians like you stay out of their business.
I would urge that children get to stay with their parents, no matter
Gentlewoman's
what
time has
parents-
expired. The committee
Mr.
will...
Chairman, may I please have unanimous
No, you can't. No, you may not. We're on a very tight time frame, and there are
enter
votes
this into
being
the
called.
congressional record.
You may, oh, yes,
Thank you, sir.
without objection, you may do that. All right, the committee will be in recess. Please hurry back after the second vote.